For veneers, I think the people that come in that, they just generally aren't happy with their smile, right? They, they don't love the shape of their teeth, or maybe the shade of their teeth, or maybe just the size of their teeth. But overall, they have good, healthy, quality teeth. I think that's a great candidate for a veneer. Like I said, veneers are very minimal prep, or sometimes even no prep, depending on the patient. And that works out great for us, right? I mean, the more conservative that we can be, the better. So I think that's a great patient for a veneer, because then we can let the lab do a lot of the heavy lifting and do the smile design for them, and then let the patient see how they look. And then after that, we always let the patient take a look. We let them see how they look on their teeth before we cement or bond anything on. But once we get the okay, we can pop them on and change the smile. Sometimes people come in here and like I said, they hear that word veneer and that's what they want. And we're more than happy to explain. I think the biggest thing when it comes to giving the patient something that they want is first listening to them and seeing what they want, but at the same time, educating them and explaining to them what is best for them and why. Sometimes if, the teeth are just a little malaligned or a little crooked, then that's easy. We can either do a full coverage crown, which is maybe a little bit more aggressive, or like a lot of times what I like to do is say, hey, maybe we should do some ortho intervention first, get the teeth in the right places, and then we can do some veneers and just explain to them how that whole process works from start to finish.